Hello, everybody. As you come in, please make sure to mute yourself so we don't have any background noise. And thank you for joining us. I think we're just gonna wait about 30 more seconds for some last minute people, but yeah, thank you, DentalShadowers, for joining us. This is a little bit different from what we usually do. We usually have it on YouTube live stream, but today we're doing it live on Zoom, so you guys can actually get more personal with our dentist today. Yeah, so also if you have any questions, go ahead and leave them in the chat anytime throughout the session. Okay, there's still some last minute people, but we should get started now. So hello everybody, hello DentalShadowers. Thank you for joining our first ever live stream. Today I have a really special guest with us. We have Dr. Park, who is an oral and maxillofacial surgeon from South Korea. And we also have his helper, Soo-Bin Yoon, who's here with us today. And yeah, whenever you're ready, Dr. Park, go ahead and take it away.
Shall we go? Yes. Okay. Okay. Hello, members of DentalShadowers. It is my pleasure and honor to be here today. I'm Dr. Jae-bong Park, an oral maxillofacial surgeon specializing in jaw surgery. Co-founder of WebSap, AI-driven dental data platform, and the director of WebSapX, a global dental academic community. First of all, let me say thank you to Krupa Paral for inviting me. I think that creating a program for pre-dental students in the crisis of COVID-19 is such an outstanding accomplishment. Congratulations and keep up the great work. Thank you, Isabel Launago. Well, most of you university students in the US. Yeah, nice to meet all. I'm going to talk about the highlights today. Last month, I actually gave a virtual shadowing lecture about the same topic on smile shadowers. Fortunately, I was able to receive good feedback. This led me to do a same lecture on dental shadowers. I hope you find my topic interesting and helpful. However, I'm not fluent in English, so during our Q&A time, Ms. Soo-Bin Yoon would be helping me out to translate. Please excuse me for this inconvenience. She's a student from Nova Southeastern University, biology on 7-year dental program. After I gave the lecture on smile shadowers, she contacted me through Instagram. Now she's our intern for WebSap. Thank you for helping me out today. Thank you, Soo-Bin Yoon. First of all, let me introduce about me and my country, Korea. I suppose our moderate and attendees are from North America, right? This is great. I am currently in South Korea, which is located in the other side of the globe, and it is 7:05 a.m. here at my clinic. You are 6 p.m. at your place. That's great. I was born in Korea and lived in a normal life with parents and my brother. This is a picture of me with my brother when we were young. My brother is working as a veterinarian in Korea. He usually deals with surgery for animals. Korea is placed surrounded by 3 oceans. Japan is located to the east, China is located to the west, and North Korea is right above South Korea to the north. And I live in Seoul, the capital of South Korea. It is located in the northern part of the country with about a population on 10 million. My house is near the Han River. It is about 1 kilometer wide, passing through the center of Seoul. And yeah, does anyone of you know this song? This title is Gangnam Style by an artist named Psy. The Gangnam mentioned in the song is the place I live with my wife and my twins, one son and one daughter. Many people in Seoul love to visit Han River to exercise and relax after work on holiday. It is such a beautiful place. After COVID-19 pandemic is over, I hope everyone can have a chance to visit my country and meet in person. So this was my story up to this point. Now I'll explain on my journey to become a dentist. And secondly, I'll share my experience before becoming an oral surgeon. Then let me discuss about jaw surgery most of the time. Also, I will introduce to you our project in progress, WebSep, an AI-driven dental data platform, and WebSep X, our academic platform. Lastly, we will have a Q&A time at the end. This might sound strange, but I never had a dream of becoming a dentist when I was a student. Thinking a dental career just frightened me thinking of the painful procedures. By any chance, did anyone of you dreamed of becoming a dentist since childhood? I personally think that those outstanding people should be the ones to go to dental school. I once dreamed of becoming a soccer player or scientist during my childhood, since like any normal child. Then as I became a student, I vaguely thought of becoming a person who can be a help to the world. This is probably because my mother would always tell me to become someone helpful in the future. However, I was not certain on how this is possible. During my high school years, I found biology interesting, which led me to major life science in Korea University. And I also thought this I like being with people. Studying biology would help my surroundings is in any circumstances. But to find out there was no people in my book, but instead chemical formulas and germs. I remember struggling studying and memorizing things in biochemistry, molecular biology, organic chemistry, and more. There was no pre-dental and pre-medical program in Korea at that time. Biology itself was interesting for me, but instead of observing the life of a cell in the lab, I thought it would be great to apply my knowledge to real people just like dentists and doctors. One day on exam that can let me go to dental school was released, like DAT in US. So this was a great chance for me, and I was excited to study hard such a TOEFL, DIT exam like DAT, and try to raise my GPA. Luckily, I was able to continue my studies in Seoul National University School of Dentistry. At first, I was surely happy to be admitted to the School of Dentistry, but is it because I expected so much? Learning about tooth morphology and decay was a new thing, and honestly, it was not that much captivating for me. In Korea, you get to spend your time in your classroom and practice room for the first 2 years. Then you get to spend your third and fourth year practicing shadowing and assisting in the university hospital. Since I guess you heard live as a dental student a lot from other lectures, so I'm gonna skip this topic, and I think I do not have to tell you to study hard as a student, right? During my dental school years, I was the captain of a rowing club. Every year we had a game with other universities in the country. And in 2011, we also had a chance to play with schools such as Melbourne University from Australia, Oxford University from England, and several universities in Japan. From what I know, various rowing clubs in US university also have great history. Anyway, the reason why I'm talking about this is because I've got to learn many things like living as a dental student, information related to treatment, choosing a specialty after graduating, opening a clinic, etc. There are things I cannot learn from books, but from my upper year mentors. Currently, as an alumni, I attend events with my children and try my best to be a help to the juniors as a mentor. This lecture for dental shadows may be one of them, I guess. So when you go to a dental school, I hope you guys can also find a club that you can enjoy in there and try to keep up the good relationship between people. I sure help you in building an aspect and living as a dentist in the future. Before moving on, let me show you a 1-minute clip of my rowing club.
Can feel my heart skip every time that I slip. I wanna run away.
Hi, Michelle.
Okay. From now on, I'll be talking about my journey in becoming an oral and maxillofacial surgeon. When you graduate, you can become a general dentist, or if you want, you can pursue your residency for 4 years and choose a specialty. For me, I chose to train for oral and maxillofacial surgeon. I started to get interested in oral surgery as I learned the anatomy. When I studied biology, all things were vague since it is not visible in my eyes, but anatomy was something I enjoyed. Of course, memorizing all parts of the body was something challenging, but once I got to know how each structure works through a specific nervous system, it was amusing. Oral surgery was fascinating as I got to apply my anatomical knowledge to find pathologies and treatments through surgeries. For example, if you look at this kind of picture, if you do not find it disgusting, but instead looks interesting, I bet you are a person like me. Pictures increase the chance for you to become an oral surgeon. This is the facial nerve that moves muscle on the face. Anyways, I plan to pursue oral surgery when I was in second year. After I realized that I should become an oral maxillofacial surgeon, I tried to look and join activities that can help me. I volunteered as a leader of a surgical part among students, and through this, I was also given a chance to be a part of a reach out program with the surgery staff in my third year. The reach out program was about cleft lip and palate. I think our audience might not be familiar with these terms. Cleft is a deformity which happens when there is a problem during pregnancy and can lead to splitting of the lips or bones of the gums. This pathology requires constant surgery after 2 months of birth, 2 years old, 5, 10, youth, and until you become an adult. However, in some locations, they lack government support and there are lots of children suffering from this pathology. So there are a lot of volunteer reach out programs to deliver surgery for free. Usually there are not enough people in reach out program, so I got to experience lots of things such as anesthesia, the surgery as an assistant. It was fun for me since I got to witness things that I only used to see in textbooks. Also, it made my heart warm when children were discharged with a better condition. I believe there are a lot of you who are willing to volunteer for such a program. I recommend you volunteer, enrich your program, independent of what specialty you would choose. It will be a time for you to preview the life of a health professional. This is when I finally became an oral maxillofacial surgery resident after graduating. It may seem cool on the outside, but in real life, becoming oral surgeon was physically and mentally challenging. First of all, there is a wide range of routes to diagnosis, treatment, and a wide range of study which will correspond. Also, you will have to research during your residency and present in conference in the country. It is such a busy life. General anesthesia is used for oral surgery, unlike other specialties. You will also have to stay up all night sometimes to respond to the needs of the admitted patient. It is certainly true that it may be physically tiring and you also have to know a lot of medical information. I can remember myself staying in the hospital as if it was my house. Things like wisdom tooth extraction and implant surgery are just one of the basic. You also get to deal with treatment for the facial trauma in bone and skin, surgery of small regions to malignant oral cancers, and reconstruction surgery using a microscope is also part of oral surgery. And orthodontic surgery, which I'll be discussing later in detail, is also part. Jaw surgery. There are a lot of field of studying which is tiring, but that is also the good part of it. Not only studying and treatment, but you would also have to research and present. You would normally start your master's or doctorate degree during your residency and constantly engage in research collaborations and present them in several conferences. Before the COVID-19 crisis affected us, I also had a chance to attend international conferences in different countries to listen to recent research and presented myself as well. These are the country that I have attended or presented in conference before. Certainly because of COVID-19, a lot of sessions were held online, which made communication with dentists from other countries much easier, just like now. This is the most recent photo when I attended a conference called Masterclass in Orthodontic Surgery, conducted in Cape Town, South Africa. It is an event where you get to share the latest knowledge about orthodontic surgery with the prominent oral surgeons from all around the world. This man here is Johan Reneke, a magnificent oral surgeon from South Africa. These are my colleagues, my advising professor, Sun Jung Hwang, and they are Professor Yang and Han. And this man, as well, is Professor Warford, an outstanding professor from Baylor University Medical Center, Texas. If one of you would become an oral surgeon in the future, I hope to see you in one of the conferences after COVID-19. Okay, there was a chance for me to be there was a chance for me to be a part of a reach out program during my training system. This time I went to Uzbekistan and delivered the surgery myself. It was a very touching moment for me. This is photo of me and the patient and the mother of patient after surgery. On the left, you can see picture before surgery, and right shows the picture after surgery. There was a great improvement, isn't it? He was an adorable child. After residency, I stayed in the hospital as a staff and future research on orthodontic surgery. I have earned my doctorate degree after 7 years, creating methods in orthodontic surgery using navigation system and robot arms. Then I promised myself to stop studying from then, but that was not the end. From now, I'll talk about orthodontic surgery from basic concept to recent research and development. So here I'm right now, as I have mentioned, I work in National and Maxillofacial Clinic located in Seoul and perform diagnosis and treatment mainly on orthodontic surgery, about 300 cases per year. Orthodontic surgery, in short, is moving the upper and lower jaw to make an ideal face and occlusion. This is photo of me. It will look like this in 3D. This is the upper jaw, maxilla, and this is the lower jaw, the mandible. These two can be separated as it's seen in the picture, maxilla and mandible. Problems such as malocclusion, joint disorders, obstructive sleep apnea, and broad range of facial imbalances such as asymmetry can be addressed and treated by orthodontic surgery. My usual practice is surgery of the upper jaw called Lefort 1 osteotomy and the lower jaw called sagittal split ramus osteotomy. I brought some nice illustration from YouTube. Okay. If you look at the patient, you can observe that the lower jaw is protruded compared to the upper jaw and cause malocclusion. This may be treated through orthodontics if the malocclusion is not severe. However, in extreme cases, a surgery is needed to reposition the bones. But before having a surgery, orthodontic procedure is needed. Then moving the upper jaw forward. After that, you will have to fix in place with a plate. You got it? Yeah. Okay, then this is a comparison of the before and after jaw surgery. Okay, here. Oh, it. Oh. Sorry. Okay. And this video show a condition where the lower jaw is retruded and is academically called skeletal class 2 malocclusion. These two can be treated with orthodontic first, then continue with the surgery, which will move the lower jaw forward. Like this. However, in general, problems are seen in both the upper and lower jaw, so it is common to perform the surgery at the same time, and this is called double jaw surgery. For accurate and precise orthodontic surgery, for a while. Okay. Surgery, oral surgeon and orthodontists have been in collaboration for a long time. This content may be a little bit more professional, but I know you guys are all smart people in the US and will understand it. This flow chart is the whole process for orthodontic surgery. Primarily, there are 3 steps. First, orthodontists always deliver the pre-surgical orthodontic treatment. Then the oral surgeon does the surgery. And lastly, the orthodontist perform the post-surgical orthodontic treatment. So, leave the last step to the orthodontist. The oral surgeon needs to focus on the second step. The oral surgery may also be divided in 3 main steps. First step is diagnose the patient facial structure and plan for the surgery. This is called surgical treatment objectives academically. And as I participated in the research and development of the first step, it result website. The next step, performing the surgery with accuracy as planned, and this research can lead to robot navigation surgery in relation to my doctorate degree. And last is to take care of hospitalized patient and outpatient. Shall we discuss more about this part? The first thing we should do is analyze and diagnose the patient face. This is my face over here. We mainly analyze them in the frontal view, lateral view, and submental view. We check the asymmetry in the frontal view, the midpoint of eyes, how much the nose is bent, the philtrum, the midline of upper and lower jaw dentition, midpoint of the chin, and etc. Then we see if there is a midline shifting that needs surgery and plan for it. We can see that the CT above show that the teeth of upper jaw is positioned to the right based on the midline. We can deal with asymmetry through double jaw surgery. I will show several times. You got it? Okay. Not only midline shifting, but rolling and or canting of the asymmetry upper jaw with different A, B height should also be examined in the frontal view. Patient like this who has asymmetry due to different height of A and B can improve their condition with double jaw surgery. This patient has visited our clinic for jaw surgery due to severe asymmetry and mandibular prolapsism. If we look at the frontal view, based on the facial midline, the lower jaw is deviated to the right. You can observe an improvement in facial asymmetry by having double jaw surgery. You can understand better by looking at the before and after surgery, CT. The asymmetry has been fixed. You can also see this patient has severe asymmetry and has been treated through double jaw surgery. And this patient also had extreme asymmetry, went through the virtual surgery of the program and has been treated as planned. You can see it got better, right? This is the lateral view, and this one is seen from below. I also prepared the pictures of the patient teeth for better understanding. This is the facial midline, and this is the horizontal line. You can observe that his upper and lower occlusion plane was not in proper place based on the reference line, but became symmetrical after surgery. Another thing that must be checked on the frontal view is in regard to the vertical problem. For having a long chin, like this patient, it is recommended to shorten the length during jaw surgery, like this. If the patient has a gummy smile, due to a long upper jaw, we should shorten the upper jaw through surgery. This is a case that positions the upper jaw upward. About 6 millimeters was moved, which is quite a big movement to correct gummy smile. A little bit difficult for you, sorry. Okay, now I'm worried that my lecture is boring, so I prepared a song to have a short break. Does anyone of you know this song, Dynamite by BTS? It was ranked to first Billboard and other European music chart. They are the Korean idol group that I'm proud of. That'll see, this song is really good. Let me continue now. This time, I'll share lateral view analysis and diagnosis. There is a difference in every culture, but statistically based on many research papers, there is a ratio and degree that is ideal and preferred by the society. Mainly, we assess location and the length of filled room and the upper and lower lips and the chin area. This is my face and it is not the ideal face ratio based on analysis. Lateral cephalometric analysis X-ray is more important than just a photo to analyze and plan the treatment. For analysis and diagnosis of X-ray, we have to trace the lateral ceph in a semi-transparent paper for all the anatomical bone structure outline. Then by using the anatomical reference point and line, we measure various lengths and angles manually, then fill in the analysis paper. Plan for the surgery based on this, then trace the upper and lower jaws by using a colored pen in cellophane for surgery simulation. Then you will be able to predict surgical outcome. This procedure requires you many materials and time, which is inconvenient. As 2D computer program was developed, these things became a little more convenient to do. We can do it quickly and comfortably without any preparation. You need just a computer to tracing all the landmark of skull. But, however, my group thought that even locating the spot manually is something bothering to do and people will be satisfied if the work can be done by AI. Also, the installment of program is expensive and it's not convenient since it is desktop-based. So in October 2019, we established a startup company called Assemble Circle. We introduced about 30,000 dentists from all over the world in the first year by releasing website and AI-driven dental cloud platform for free. Before I explain further into this, let's watch a promotion video clip we released recently targeting dentists. Then where was the AI technology used? You know, can you make a guess? AI is applied in finding our points of interest and tracing the outline of the bone. Through this, we are diagnosing and analyzing before surgery, simulation, and comparing the before and after of surgery through X-ray overlapping. These features spared us from a lot of boring and routine-based tasks that we don't want to do. By using website, with just one click, you can do tracing. AI model can find lots of landmarks in seconds. Various analysis and diagnosis is possible based on this. These are what dentists use to analyze and diagnose those patients. Looks fast and really easy, right? As you can see in this video, AI automatically detects the landmark in real time in many materials. You can see that it is very fast and quite precise. This is Dr. Kim, my colleague, and also founder of Assembly Circuit. This video introduced the AI model that finds soft tissue outline quickly. This model is also included in WebSet. There is a feature that overlaps the image of the face to the soft tissue outline of the X-ray. This AI model gives further benefit in simulating the jaw surgery. In the program, you can move the upper and lower jaw as planned, apply virtual surgery on maxilla and mandible, and lastly at the chin. Then you will be able to visualize the approximate result after surgery, after some adjustment in detail, and push the merge button, you can see the virtual surgery display. Of course, this is not 100% accurate, but it provides you with the estimated outcome. This is a research paper I conducted before. If you look at carefully, I overlapped the manual tracing of the before and after surgery. It is a long and inconvenient work to do, but by using an AI model, you can do it very easily, just one click. So this was about WebSet. Currently, we have 12 global servers and 30,000 members around the world. We would be grateful if more dentists can have an opportunity to join us. And I hope you guys will be one of them. Yeah. And I hope you guys will be one of them. It's free until now. There are some more things left. Can I continue? About 10 minutes, 5, 10 minutes. Okay.
Yeah, you can continue.
Yeah. Okay. Now I will briefly explain my recent research on robot technology in orthodontic surgery. I believe you have heard a lot of time about fourth industrial revolution. Fourth industrial revolution blurs the line between physical, digital, and biological spheres in all industrial markets. Some of the main technology of fourth industrial revolution are big data, AI, cloud, robot, and animal. So how does it apply to the orthodontic surgery? WebSet, which is I already mentioned, is related to AI and big data, and robot and navigation assisted surgery is what I researched recently. In the flow chart, the blue portion are related to the WebSet for accurate diagnosis, and red portion, which I will discuss from now, are related to the technology for an accurate surgery cell. In These techniques I practice in my clinic, fortunately with the recent development of 3D program and scanner, 3D printing technology, the surgery results have been more accurate. However, since surgery is done by a person, there are always errors, cause hand fatigue and trembling of the hand, and eyes can't precisely confirm three-dimensional location of the bone. We thought that navigation system and robot arm can replace these limitations. And I had studied about robot arm and navigation assist orthodontic surgery with Professor Huang after cutting and separating the upper jaw. And I moved the separate upper jaw by using a robot arm and navigation system, not the hand. The arm of robot I used has a 3D positioning memory function. When the user teaches several movements in 3D space, the robot memorizes that and moves exactly same as memorized within a 0.1 millimeter errors or less. Okay. This picture shows preparation for the surgery. There is a navigation system. It traces the robot arm in real-time display, so we can find out surgery was performed as planned. The tracing tools of the head is registered the same point of virtual model, and tracing tools connected to upper jaw in actual space is also registered to the same position in the virtual space. So that when the upper jaw is moving by robot arm, the virtual jaw also moves to the same position. After completing our preparation, I cut the upper jaw and move it to the planned location. When getting close to planned locations, we move the upper jaw precisely in millimeter scale using a smart pad. If the error is no longer reduced, to fix the upper jaw with the plate at that position. In summary of research, we applied robot and navigation techniques to the bone repositioning process to avoid errors in conventional method, and the result of this study confirmed that this process was accurate enough to reach a clinically satisfactory model level. So far, I introduced the latest research. Actually, in my opinion, there are lots of limitations about applying robotics in orthodontic surgery for now. However, the robot arm is getting cheaper, smaller, simpler, and more precise. So I'm sure that robot arm will be used as an assistant in orthodontic surgery in the future. I think the time is running a bit late. It might have been a difficult content, but thank you for listening my lecture. At the end, I will introduce to you the Facebook group which I created last year. WebSabX is a global dental academic community that started as Facebook group. Recently, WebSabX have reached 11,000 dentists from all over the world. In addition, speakers from various countries are invited to organize and hold web seminars one time a week with interesting topics. So far, a total of 58 webinars have been held through Zoom and Facebook live streaming. We encourage you to join us, and we hope you guys can take advantage of this group to build a connection with dentists all around the world. Let me end the session with a short clip I prepared about website text.
Here is a quick tip for you guys. You'll see here that
I welcome contact through Instagram message, Facebook message, and email regarding further question. Thank you for your presence and attention, and thank you for inviting me to this great opportunity. I hope that all of you will continue their careers in dental school, and after graduating, I wish that you find your career interesting, enjoyable, and satisfactory. Keep yourself healthy and safe until the day we have a chance to meet each other again. Thank you. Thank you very much.
Thank you, Dr. Park. That was a great presentation. And everyone, if you want to join his Facebook group, WebSefX, that looked like an amazing resource. So check that out. And now Joy is going to read some questions that we had from the chat.
Yes, so we have some questions for you. And the first question is, where can you commonly find reach out programs? Are they international and what are the requirements?
봉사활동 관련된 얘기인가요? 수빈 학생 그 turn up on your
네, 제가 아까 카카오톡에 말씀드렸듯이 봉사활동보다는 치과 의사분들과 컨택할 수 있는 거를 말하는 것 같아요.
치과 의사분들.
Is it Andy who asked that
Yes.
question? Yeah, could you like define what you mean by reach out programs? Like, do you just mean by like making connections with other dentists, or do you mean like research programs?
일단은 리처 프로그램 같은 경우에는 치과대학 학생으로 진행하다 보면 학교에서 많은 기회가 있을 겁니다. 그건 1번이고 예를 들어 이제 덴티스트와 많이 만나고 싶으면은 물론 제일 좋게는 우리 웹셉 X에 들어와가지고 이제 덴티스트 그 웹셉에 3만 명의 덴티스트가 있으니까 거기서 우리가 멘토 멘티 프로그램을 곧 시행할 예정이니 그쪽에서도 많은 기회가 있으면 좋을 것 같습니다.
So you'll meet most of the dentists like during dental schools, and for regarding research opportunities, so you would have a lot of those during dental school years. But he also recommends joining WebSefX, as we are now planning to have a new session targeted towards our pre-dental and dental students, where you can meet over 3만 명이라고 하셨죠?
네, 3만.
네, over 30,000 dentists from all around the world. So join WebSefX.
Okay, thank you for translating. And then our second question is, I think you asked this one. Can you be a little bit more specific on what you mean by? Oh,
I asked that too.
Okay.
I'm asking that too.
Okay. So next is, what is the most satisfying and dissatisfying parts of your job?
네.
satisfied 부분은 일단은 수술 환자의 만족도, 환자분들이 수술을 하고 새로운 삶을 살면서 제가 편지를 정말 많이 받아요. I receive lots of letters from my patient. 예, 그게 가장 내가 satisfied 하는 부분이고 unsatisfied 하는 부분은 없는데 굳이 꼽자면 힘들어요, 과정.
So the advantage of being a dentist, like as his job, is that like it's very satisfying. Like for example, he receives a lot of like thank you cards from his patients, and he says that there aren't like specific disadvantages, but if he has to pick one, it's that it's just physically hard.
Okay. Our next question is, do oral surgeons work with others in a team of doctors, or is it more independent?
Yes, we usually work with general anesthesiologist, 마취과 의사, and nurse and assistant, and many assistants and dentists who are assisting me with the surgery. So when I perform the jaw surgery, at least 6 members I need. I need 6 members for surgery.
Yeah, that's a really big team. Okay. does eating habits when you're an infant have a big impact to jaw structure as much as genetics? And do you think modern eating habits have caused more severe jaw misalignments?
음, 어, 이건 한국말로 해야겠다.
네.
예, 일단 첫 번째 턱 모양에 영향을 주는 거는 유전적인 영향과 환경적인 영향이 있는데 어떤 게 더 크다고 말을 할 수는 없습니다.
So things that affect jaw structure aren't just only genetic causes, but there's also environmental causes. So you can't just like straightly say that it's either one, like 100%.
그리고 유아기 때 먹는 습관은 모포로지보다는 치아의 구조에 영향을 줄 가능성이 큽니다.
So your eating habits during your infant years would rather more affect your teeth alignment rather than your jaw structure.
실제로 현대의 식습관이 점점 딱딱한 것에서 소프트 밀로 바뀌면서 조의 크기나 그 힘이나 스트럭처가 변화됐다는 학설이 논문에 많이 있습니다.
So on a research paper, researchers actually found that like modern eating habits are now shifting from eating hard food to rather more soft food. So it's actually like change. 어떻게 변화가 돼요?
한 가지, for example, you know, third molar, wisdom tooth. wisdom tooth 원래는 걔네가 완전히 다 나 있어서 사랑니 발치를 할 필요가 없었는데 예전에는 요즘에는 턱이 작아지면서 third 몰라가 날 자리가 없어서 다 파묻혀 있어서 발치를 해야 되죠. 뭐 그런 변화들.
So as our modern eating habits are shifting from soft food to hard food, so our jaw structure is actually getting smaller. So our jaw is getting smaller, like our chin. So in the past, for most people, the wisdom tooth would come out. But now since our jaw and chin is getting smaller due to our eating habits, now like people are taking out their wisdom tooth. So that's a big change.
Oh, that's really interesting. Our next question is, do you have a recommendation on this AI tool for pre-dental students to access?
뭐 AI tool for pre-dental student이냐고 물어보시는 건가요?
네, 맞아요. 예과 학생들이 쓸 수 있는 AI 기능들이 있을까요?
웹셉에는 아까 그 트레이싱 툴, 트레이싱 툴 for orthodontic treatment가 있을 수 있고, 기본적으로 가장 중요한 건 클라우드 시스템이기 때문에 당신이 지금부터 보는 모든 환자에 대한 정보를 무료로 저장할 수 있다.
그 웹셉을 그럼 예과 학생들도 쓸 수 있는 거예요?
네, 수빈 양도 쓸 수 있고, 조이도 쓸 수 있어요.
Okay, so for pre-dental students, he is also recommending WebSef as it is open to everyone. And so dentists would file, and so it's like a cloud service. So they would save their cases and like pictures of x-ray of their patients. And you can look through all those pictures and there are like thousands of files. So he recommends WebSef.
Okay.
Yeah, I just leave it down to chat box, our platform, website.com. I already mentioned about that. It is free for all around the world dentists, and our policy for payment is should not we don't need to change the payment policy. It will be free forever only for cloud, for X-ray, so you can join and you can use it anywhere.
It's pretty awesome. And the next question is, do you have any words of wisdom or life advice you can share being where you are now.
내가 잘 못 들었고.
제가 방금 카카오톡으로도 보내드렸는데 인생 조언이 있으시다면 한 말씀만 해주세요.
내가 조언할 정도의 사람은 아니고, keep going, 열심히, study hard, keep going, and challenging all the things. You can do everything because you are younger than me, and you can achieve all things that I mentioned already because you are younger than me and you are smarter than me, and most important thing is you can speak English well rather than me. So it is very important to you. You can do it everything.
Okay. So our next question is, besides for oral and maxillofacial surgery, what other fields of dentistry have you seen an increase in the use of artificial intelligence?
구강 아간면외과 말고도 그 다른 과에서도 그 AI를 쓰는 과가 있을까요?
제가 그 강의 중에도 잠시 얘기했지만 이 AI 아티클이 지금 First Industrial Revolution and 하면서 이게 all the industry에 AI가 들어가고 있고 dentistry also dentistry도 하고 있어. 모든 과에서 지금 이쪽이 굉장히 핫한 분야예요.
Okay. So after the first industrial revolution and as we are going into the fourth industrial revolution, it is not just his field, it is all of the fields in dentistry are now interested in using AI. So basically like all the fields in dentistry are now interested and are using AI in their fields.
Yeah. Okay, I agree. We have room for one last question. And what is the most interesting case he has worked on?
Could you repeat that? I didn't.
What is the most interesting case he has worked on?
가장 흥미롭거나 인상 깊었던 케이스가 있으시면 설명해 주세요.
저 서저리에서요?
네.
워낙에 조 서저리 케이스 중에서 가장 흥미로웠던 거는 서저리 자체보다는 수술 후에 환자의 얼굴뿐 아니라 멘탈적인 부분 그리고 삶에 대한 부분이 완전히 변해서 그런 피드백을 편지로 받았을 때 그게 가장 즐거웠던 경험입니다.
근데 가장 인상 깊었던 케이스가 있을까요?
케이스?
네.
케이스가 있긴 한데 보여드려야 되는지 잠시.
네.
뭐 인상 깊었던 케이스. 네.
예를 들어 뭐 주걱턱을 고친 케이스였던 그냥 간단하게.
너무 케이스가 많은데. I have lots of cases. I already mentioned 300 cases per year, so I don't remember one most important case, but I remember that who have changed his life after surgery, and have confidence after surgery. He is very I remember him. Not only just surgery, but his change after surgery is, yeah, I remember.
Okay, I think that's all the questions that we get. And thank you so much again for your presentation and Subin being here for translating out this. Thank you so much.
Yeah, I actually saw one last question for Subin, if you want to answer that.
Wow.
Okay, so I think there was a misunderstanding when Isabel introduced me in the chat. So what Dr. Park said in the presentation is actually correct. So I'm still a pre-dental student, and I'm a sophomore. So I'm not in dental school right now. So I'm actually a sophomore in the undergraduate years, but I go to a 7-year dental program in Nova Southeastern University. So yeah, so I think that kind of answers your question.
Sorry about that.
No, it's okay. But I like to like partially kind of answer that. So I kind of lived everywhere. So I graduated elementary school in Budapest, Hungary, and then I spent my middle school years in Korea, and then I graduated high school in Missouri. So and then now I'm in the US. So yeah, so I guess that kind of partially answers your question.
Wow, that's amazing. Well, yeah, it's 4:02, and I don't want to keep Dr. Park or Subin waiting because I think it's really early for them right now. But thank you so much for this amazing presentation and for hosting our first ever live dental shadowing event. So thank you so much. The presentation was really cool, and I learned a lot of things, and I'm sure everyone here also learned a lot of new things. So thank you. And for the dental shadowers, Joy put the quiz in the chat. So just fill out that quiz. You have 12 hours to complete the quiz and before it closes. And yeah, thank you for joining us.
Thank you so
Thank
much
you.
for hosting.
Thank you for inviting me as your speaker. It's my honor to giving a lecture to you in US this time. It is 8 a.m. here. 8 a.m. here. I want to eat breakfast.
Thank you.
Yeah, thank
Thank
you.
you very much. Thank you. Bye.
Bye.